Hello, class. My name is Zemba Katambo, and I'm going to present my project part two paper. And this is Cognitive Psychology class by Dr. Julie Paul as the instructor. I selected a topic on poor retention among children, and this topic is significant because it affects many children and has lasting impacts if not addressed on time. For example, poor retention affects self esteem and overall functioning in affected children. The disorder is associated with impairments in working memory caused by factors such as stress. This topic is essential, and the psychologist must understand the pathogenesis of poor retention to choose the appropriate intervention that targets the underlying problem. In most cases, poor retention indicates a problem in encoding and storing information in the working memory. The working memory capacity differs from one child to another, and the effects of poor retention in children often manifest in academic achievement, language, and learning proficiencies. This PowerPoint presentation is going to highlight five articles, and it's going to provide a detailed highlight of the topic, the proposed intervention, goals, objective, cognitive principles, expected outcomes, and the evaluation plan. This slide covers an article by Chen and colleagues, and the title of the article is Evaluation of Children's Cognitive Load in Processing and Storage of Their Spatial Working Memory. This article reveals that children have limited working memory, which is expected to improve as they grow and achieve developmental milestones at the right time. However, poor retention is common in this population due to various reasons or factors. For instance, children exposed to stress tend to have impaired working memory, which leads to poor retention. Working memory supports information processing, storage, and retrieval from long term memory. Therefore, working memory supports academic achievement, reasoning, and problem solving abilities. The tasks children are exposed to, experience, and their attention to the assignment impact working memory and determine the degree of retention. Poor retention is possible when a child faces multiple tasks that compete for limited cognitive resources. This research by Chen and colleagues generated outcomes confirming a relationship between working memory and poor retention. Right? So this slide highlights the third article by Frostberg and colleagues. And this article is titled Their Working Memory Capacity Limitations Directly Constrain Children's Long Term Retention. These researchers supported the assumption that the working memory improves as children grow up. The working memory undergoes rapid development during the school years. Conversely, long term memory does not have an age limit but depends on the function of the working memory. The ability of working memory to encode and recall information impacts the functionality of long term memory. Retention in children depends on the functionality and long term memory. Short and long term memory enhances children's performance in everyday life and formal education. Fluid intelligence and reasoning capacity affect working memory and academic performance. Therefore, the working memory limitations affect the tasks a child can handle at a time. Thus, the limitation on working memory determines the number of items a child can identify in long term tests. A decreased working memory load improves the number of items a child can remember in long term memory. The next slide. right? This slide presents an article by Bauer, and the title is called Retention in Online Courses Exploring Issues and Solutions, a Literature Review. This researcher proposed managing the working memory load to enhance changes in long term memory. This researcher presumed that a well managed working memory translates into a functioning long term memory. For this reason, the scholar conducted a study to establish factors that impact working memory. This study outcomes revealed that the factors affecting working memory are learning setting, experience, and the task. For instance, the working memory of students engaged in online learning experience some limitations due to changes in approach that differ from the traditional class setup. The online platform denied learners a chance to experience visible identities, live deliberations, and interaction with the teachers and peers that facilitate information encoding, storage, and retrieval. Therefore, a lack of experience to relate with in the future may contribute to poor retention and performance in activities engaging long term memory. Next slide. Okay, this slide conveys the finding of an article by Wiguna and colleagues, and the article is titled Learning Difficulties and Working Memory Deficits Among Primary School Students in Jakarta, Indonesia. These researchers identify various factors responsible for poor retention among children. The reasons for poor retention in this population are associated with the impairments affecting working memory. For instance, some children experience working memory impairments caused by brain process disruptions. In such a case, the children experience learning difficulties. Working memory plays a role in children's poor retention in cases of failed information manipulation. Some circumstances, such as mental disorders, affect the working memory, making poor retention inevitable. Therefore, children suspected of learning challenges or other developmental delays should receive immediate intervention to enhance long term memory and retention. The researchers also provide effective interventions for children with working memory problems. This intervention include direct working memory training, strategy training, and classroom intervention. Right. Okay. Next slide. Okay. This slide presents the article by Rowe and colleagues titled Interventions Targeting Working Memory in 4 to 11-year-olds Within Their Everyday Contexts, a Systematic Review. These researchers agree that limited working memory is a cause of poor retention depending on the nature and number of tasks. Multitasking affects performance in working memory as the functions compete for cognitive resources. The working memory encounters rapid development in the first 10 years of life. Primarily, children achieve adult capacity at the age of 14. Working memory plays a significant role in learning, attention, language, and reading development. Children experiencing poor working memory encounter many issues, including problems remembering instructions, which trigger poor performance. This study findings highlighted in the article confirm working memory in children varies from one person to another. Hence, psychologists should consider the child's age when assessing working memory function and performance to diagnose poor retention accurately. Treatment depends on the underlying cause and therapeutic goals. Next slide. This slide identifies the proposed intervention, which is direct working memory training. This intervention involves play, working memory, and physical activity to promote information transfer skills. The implementation team will choose to deliver direct working memory training with strategy instructions comprising of martial arts, sports, music, traditional children's games, and yoga. The choice of activity will depend on the child's age and the treatment goal. The identified activities improve executive functional skills, including working memory. The goals and objectives include the short term and long term expectations of the intervention, respectively. The goal is to promote the participants' working memory by at least 5% in 3 months, as measured by past and current performances score in language and learning activities. The objective is to improve retention and educational achievement in the long term, depending on an individual's developmental stage. Next slide. So this slide explains the target population, methods and materials, cognitive principles, assessment, and evaluation. This intervention targets children aged between 5 and 10. The program will use an observational design where the psychologist and the implementation team will observe the participants and record findings for data analysis. A chart will facilitate data collection, and the psychologist will complete before and after scores to establish the changes attained through the program. The cognitive principle adopted to direct the program is time based resource sharing, that is the TBRS model. And this model presumes that challenges experienced when processing information increase cognitive load when time is limited, causing poor memory performance. The PDSA cycle will apply to facilitate the assessment or evaluation process. The model supports identifying a team, problem, program implementation, a thorough assessment, and intervention application in clinical settings. The adaptation of the intervention in patient care will depend on the outcome and effect in improving patient care. The expected outcomes are in three areas: working memory, performance, and long term memory. The intervention is expected to impact the working memory positively through enhanced information processing, encoding, and storage. Also, the intervention will improve performance as portrayed by enhanced reading, information retention, and recall. Moreover, long term memory will experience improvements in the successful retrieval of information. These improvements highlighted will translate to the overall improvements of retention as participants improve in class activities. Therefore, the participants diagnosed with poor retention will demonstrate some improvements in their working memory. Next slide. This slide reflects on the learning derived from the activity. This literature review provides adequate evidence based information showing poor retention is a problem affecting many children or patients, especially children. Working memory tasks, competing activities, mental disorders, and stress contribute to poor retention. Working memory is an important system, and the therapist and client must address any challenges affecting it to understand poor retention. The working memory supports the attention provided on activities. The system facilitates information processing, storage, and retrieval. Working memory improves as children grow. From this perspective, working memory impairments cause poor retention. This slide provides a conclusion highlighting the main identities from the learning. The main points include poor retention, a common disorder among children. This disorder has lasting effects on children, such as poor working memory. Various interventions, such as direct training programs, address the problem. The activities incorporated in the training program enhance the working memory function and information retention for future use. The presentation shows that poor retention is a medical issue and the treatment strategies exist. Therefore, children need a timely diagnosis and access to therapy for improved health outcomes. This marks the end of my presentation, and these are the references that I use to support my presentation. Thank you for listening and watching my presentation. Thank you so much.